And we'll now go to the third session on urban health. So we know that air quality, access to green areas and green transport are some of the aspects to be prioritized to increase urban health. And we'll see here two emerging applications based on satellite data and signals that will support cities to become healthier. So our first speaker is Mr. Evangelos Gerasopoulos. He's Research Director of the Institute of Environmental Research and Sustainable Development of the National Observatory of Athens. Evangelos represents Greece in relevant international bodies in the field of Earth observation. He's the director of the Greek Geo Office and is been participating in or coordinating more than 35 European and national funded projects. And he will tell us about a very interesting platform for cities to access information on their air quality. So Evangelos, the floor is yours.
Thank you, Grazia, for your nice introduction. So I will present you a specific platform that enables different level of stakeholders to report on SDG indicator 11.6.2, which is relevant to air quality and health. So what is the challenge behind? The challenge behind is that almost 75% of the European citizens live in urban areas, and 90% of those are exposed to harmful air pollution. And it has been estimated that over 400,000 premature deaths in Europe can be assigned to the impacts of PM 2.5. On the other hand, if measures are to be taken, then cities is for sure the right place to do so. For many reasons, but mainly because of the high concentration of the people living there. In order to enable a reporting of the air quality levels at different UN or European organizations, there have been some specific indicators developed. The newest one comes from the UN level, and it's relevant to the SDG 11, which is on urban health and resilient societies. And I'm talking specifically for 11.6.2, which refers to the annual mean levels of the fine particulate matter in seats when weighted by population. Then when it comes to the European level, then Eurostat, with the help of the European Environmental Agency, has another indicator which is relevant, SDG 1150, which deals with exposure to air pollution by particulate matter. So, and if you go even down to the national level, then many countries have adopted maybe different indicators. So we see that there is a clear need for reporting at the national level for the air quality levels of PM particulate matter in their cities. But there are many challenges behind doing this kind of reporting and assuring consistency between the different numbers given from countries. One of these challenges is the definition of the cities. There is no currently one single definition of what is a city, and in this sense, Habitat 3 has committed to develop such a global people-based definition of cities and settlement, and this would definitely enable the implementation of the urban agenda and also the monitoring, but also the achievement of the urban SDG 11 in general. So currently there are two definitions. One coming from the EU OECD, it's the definition of the urban center or degree of urbanization, and the second one is the functional urban area definition, which I will present you now. So the first one, the urban center, is defined either as contiguous grid cells within a city with population density of at least 1,500 inhabitants per square kilometer, or equally, a density of built-up area greater than 50% per square kilometer, and at least 50,000 total population. So this is a definition that actually defines urban centers within a city. Then the second definition is a little bit broader. It's talking about functional urban areas, so it actually adds on the previous definition the commuting zones, because people are not exposed only when they live, but also during their transport to their works or other activities. However, the definition of the urban, of the city, according to these two methodologies, is very important with respect to the numbers that you might be getting for the indicator. More challenges. To what extent is monitoring equivalent? Currently, cities are mostly using values from the regulatory networks to report on PM2.5 particulate matter concentrations, but not all cities have regulatory networks, because it's from a threshold, population threshold and up, that cities are obliged. However, there are many smaller cities, smaller giants as used to be called, that suffer from degraded air quality but don't have measurements. The other point is that depending on the characterization of the sites and the distribution of the sites within a city, then you might have biases in the reported numbers. And then finally, it's not absolutely transparent how those numbers are extracted and how those numbers are reported to the competent authorities. So within a European project called SMURBS, a 9 million project within Horizon 2020, coordinated by the National Observatory of Athens, we have tried to bring together Earth observation and smart city approaches to deliver a number of solutions in urban relevant environmental stressors. And when we are talking about Earth observation, it is important to keep in mind that this definition is a little bit broader than satellite data on their own. So we are talking mainly about satellite data, but also in situ data, modeling of the Earth system, smart sensors, the Internet of Things, as well as citizen observatories. And it is very important to see how all these platforms can be combined and then fused in order to produce, more advanced services for the cities. And all these solutions we are including within SMURBS, which needs something like 8 months until its completion, into a portfolio of smart urban solutions, which will be soon released. The stakeholders involved in one of the environmental stressors that we are addressing, air quality, the others being natural disasters and urban growth, are city authorities and urban planners, environmental and health agencies, competent ministries like environment and health, statistical agencies, very important, Eurostat, WHO, and UN Habitat. So the platform itself now. As I told you, as I have already told you, we are combining different types of Earth observation, having satellite data as the flagship, and there has already been an exercise made within the Group on Earth Observations. This is an intergovernmental panel committee under the United Nations and WMO that coordinates satellite data and other EO platforms globally to deliver specific services. And the exercise has been to match up which of the indicators under the SDG frame can be really addressed and assessed by Earth observation. And we see that under SDG 11, there are many applications that really Earth observation can make the difference. So we, based on this, in our project, we tried to make use of Copernicus services. First, Copernicus Atmospheric Monitoring Service for the retrieval of PM2.5 concentration, which is a mixture of satellite data with an ensemble of models and in situ information, producing an evaluated outcome. Copernicus Land Monitoring Service with respect to the Urban Atlas and the Global Human Settlement Layer, from which we got the build-up area and the population, and we calculated for more than 800 cities in Europe the value of the 11.6.2 SDG indicator. This indicator is nothing more than the concentration of PM2.5 per city in a country, weighted by the population, and then this product is used to calculate the national MID, which is the official report that countries need to do to UN and Eurostat. And this is how the platform looks like. So on one hand, you have the map of Europe and the 800 cities, the two definitions combined, the urban center and the functional urban areas. You can select between different years, and as time passes, we add more and more years. And you can get access to information about the country, but also individual cities, about the annual mean of PM2.5. And also the platform enables plotting specific graphs of interest. The advantages of the platform are that they deliver a horizontal approach for all cities and nations. So actually they allow and enable comparability between different cities and countries. They use two city definitions, so the urban centers and the functional urban areas. So local decision makers are able to see what is the status of air quality within the urban center, but also in a broader extent in the city. As I said, it enables identification of hotspots, doing maps and graphs, and in general, it's a tool that at the end, or at least initially, it was intended to help national reporting of the SDGs, but as it has been evolving, we realize that it might have many other useful uses. So going through the uses and targeting different stakeholders. So if we talk at the European level, it actually enables tracking patterns of pollution, particulate matter pollution along Europe. For example, here you can see the trend from cleaner to more polluted areas as you move from west to east and from north to south. But also it enables seeing trends. First of all, comparison between countries, but also trends within the years already in the platform. It is also a national indicator. It provides national value, reporting value, and this is a harmonized reporting. So it's an horizontal way that all countries in Europe can report about the PM2.5 values in their major cities, but also the average of the country. And then if you go in the country, it enables identifying and studying cities as hotspots, for example, and this enables targeted mitigation strategies. So here we see Italy, for example, and in Italy we can really see that at the north areas there are cities that the concentration of PM2.5 are much higher, and we can actually estimate and quantify how much this triggers the national value of the indicator versus other cities that lie in the south of Italy, etc., etc. And it enables plotting of those cities, comparing the cities with the national average, and also with limits provided, the thresholds provided by WHO and the European Union. It's also very interesting to see how much this city definition might influence the results. So here I have isolated two examples. For example, when we are talking about urban centers, we see that and functional urban areas, we see that in one case, United Kingdom is below the WHO recommended value, while when you go to the urban centers, it goes above, the color changes. And the same happens to Serbia, for example, where you can see that from orange it goes to red. So a stakeholder can play around and see what you know, are the factors that might be driving national values, averages of PM2.5. So there are many challenges and perspectives still to be added on this platform. One of these perspectives we are currently working in a specific pilot in the E-Shape project that already has been referred by other speakers. Here you see a map in Athens, and not only urban centers and or the whole functional area, but now we are trying to go down to the municipality level or other local authority unit of choice and dig out the information for the municipality, disaggregated information about air quality. Then, when available, there may be extra layers in a GIS environment of health data or socioeconomic data, and this platform will be enabling a delineation of the reciprocal relationships between air quality with health, but also with other socioeconomic factors, and at the end of the day will be enabling localized and personalized information, which after surveys that we have been running in SMURBS project, it turned out that it is something that citizens and local stakeholders really like to have. There are many challenges behind this. The reluctance in the application of approaches like that, like the reluctance in some cases of authorities or agencies to disturb their workflows or include other types of data apart from on top of regulatory networks. An important problem is the availability of health and socioeconomic data at the disaggregated level that is needed for such applications. And maybe it is very important for cities to start building databases to collect this information. Sometimes human resources inadequacy, mostly not usually it is in terms of numbers within authorities, not in skills, because many authorities have really skilled people. And finally, we recognize that in many cities, capacity building is necessary in order to make this collaboration with research institutes or private companies that have services to make it really an operational service. And I think with this, I would like to thank you. And this is the link where you can access the platform and play around. And I hope you enjoyed. Thank you.
Thank you so much, Evangelos. Very interesting platform. I would assume that it is too early to ask you how this information has been already used in by city authorities.
Still, I can answer you. With the E-Shape project, we ran a co-design approach exercise where we came in touch with Ministries of Environment and Health in Athens. And we explained that on top of this platform, if we had access to this disaggregated information that I talked about with health and socioeconomic, we could really build, you know, a zoom of this platform within the city of Athens and have all this information at the municipality level. And I should tell you that it's working fine. We are having next week a new meeting to talk about the details of how to design this new platform, and we are already talking about the uses adjusted really to the their operational needs. So I mean, this co-design and this discussion directly with stakeholders is really important, and it's happening.
Yes, definitely. So the data in the platform are already quite easy to consult, and I guess that if you then make a categorization based on operational needs, it's going to be easier, even easier for cities to look for this data, but especially to do something with that, which of course, I mean, implies other aspects of the value-adding chain and using chain in this sector. So we will run our 2 short polls on the platform. So the first question will be if you think that the service presented is useful, easy to use, reliable, cost efficient, or innovative. Okay. All right. So okay. So for once here. You convinced the audience that the service is easy to use, and I think that everybody agrees on the need to monitor air quality in our cities. So let's go with the second poll. If you would like your city to invest, well, in this case, I will say that if you would like your city to use this kind of data, since the solution is already there and has been already funded, and of course, it will be key, of course, yes, 100%. It will be key to sustain the existence of this platform in the future and the update of this platform in the future for cities to actually use this data operationally in the long term. And we now go, so thanks a lot, Evangelos. We now go with the last presentation within our sessions before starting with our final panel. And we have a joint presentation from Birgitte Andersen from CWare, Circular Economy, and David Ludlow from the CURE project, Copernicus for Urban Resilience in Europe. Birgitte is actually an economist with a specialization in strategic and structural assessment of industries, including value chain dynamics. And she has 23 years of international experience working in and for the European Commission, ESA, the European Environment Agency, the OECD, and private industry. While David Ludlow is an associate professor of European Smart Cities at the University of the West of England in Bristol. Overall, he's been responsible for the development and implementation of more than 50 EU-funded international research and innovation projects. Their joint presentation will describe a joint project to enhance urban health with satellite data. Are Birgitte and David there? They should be.
Yes, I'm here, so I wait for Birgitte. Grazia, if that's okay. I guess she's going to come.
Yes, absolutely. And I think that in the meanwhile, if you want, you can share your screen, share your open your webcam, I mean.
Can you hear me?
Yes, Birgitte, we can hear you.
Yes, I'm here. I'm just not sure how I can share my screen.
Okay, you should be able
show
to
my
do
screen.
it now.
Wait a minute, it should be here.
All right.
I think.
Okay, you're sharing your screen. That's great.
Grazia, also I have a problem with the sharing, so we're doing this presentation from Birgitte. And
okay, great.
I can't actually also switch my camera on, I'm afraid, so it's going to be a bit of a blank from my side.
Okay. I don't know how to solve that, and I don't know why this happens.
Can you see my screen?
We can see your screen. We can't see you, but we can see your screen.
Okay. Here we go.
You can just go in presentation mode and.
Yeah. I'll try. Share my webcam. Well, my webcam, yeah, I had problems with that. each of these systems are different. You see my screen fine now? Or?
We see your screen. I think if you just enlarge the PowerPoint.
Yes, that's it.
Here we go.
Okay, great.
All right. Okay, well, good afternoon, and thank you for inviting us for this presentation on some of the perspectives we have in the CURE project. So I will be sharing this presentation with David from the University of West England. Okay, now I just have to find out how to change the slides. It's here. I hope. Yes. Yeah, I was already presented, so I'm now a partner in the company CWare, and we are based in these nice buildings in the center of Copenhagen, which in fact is a hub for the Nordic sustainability cities. So there's a lot of different startups and everything here, so a lot of interesting things going on. So we were quite lucky that we could get a spot here to be part of this network. Boom, here we go. This is kind of the outline of what we would like to address today. So just a brief introduction to the CURE project. Then David will present the user perspective of the air quality application we are developing in CURE, and also some of the drivers. Then a little bit about what do we mean about urban health and what is driving it. And then we will go into a little bit more details about what we will be developing in the CURE projects in terms of measuring the health impact, but also the health cost, in fact. So, boom, here we go. So the CURE project started in January 2020, so we are still quite in the beginning, and now all the corona has really also delayed everything a little bit. But the idea is that we will be looking across all the different Copernicus core services in order to define what could be urban core services, Copernicus urban core services in the future. And if you can see down here, this is some of the services which would be tested. So there's a lot about temperature, urban heat, CO2 emissions, flood risk, air quality, thermal comfort, nature-based solutions. And then our role in the project, CWare's role is to try to also include some of the socio-economic perspectives to some of this. We have 4 cities involved as first movers, and then there's a number of follower cities. So it's not all services that would be developed for all cities, but you can see the distribution here on that map. And then David, you take over from here. Next 2 slides.
Okay. Yes, thanks, Birgitte. Yeah, so the starting point for the user perspective, actually the starting point for all smart city governance R&I projects like CURE is the user perspective. And in this case, it's the perspective of the city planner. Birgit just mentioned we have cities involved as front runner and follower cities. So we're very much looking to develop decision support aids, if you like, for city planning. And basically, the framework for that those decision support is the open, integrated, and common frameworks for decision making. So these are the principles on which we found the development of the Copernicus applications, which are applications which are also integrated with in situ and other data. In other words, we don't discriminate between Copernicus and other data. Whatever we can put into the mix from an urban planning point of view to support the decision making is the critical thing. And this decision making process is then directed, of course, towards the political objective of the city, the policy drive. And we can see that cities, the policy drive fundamentally and commonly is about focus on transitions to carbon neutral, healthy and sustainable cities, Also supported, of course, at the European level through the Urban Agenda, and globally, as we've seen just in the previous presentation, in respect of the SDGs. So it's this policy frame that is the fundamental perspective for the definition of the tools that we develop. It's mediated and sensed by and targeted through land use planning. In other words, land use planning is the means by which we operationalize the data, by which we achieve the political objectives in the management of the city region to address these global political concerns, which we can see are common, and that's also why we address the issue of commonality, because we can see that the common problems of cities, not only in Europe, are reflected in the potentials for common solutions, and we can see that in urban planning. And of course, therefore, we have the potential for common technology applications like Copernicus, and this is massively supporting the business model, of course. Land use management then is actually delivered by policy strategies, and these include things like climate change mitigation and adaptation. And so we can see the bottom of the slide here a couple of examples. Policies targeting climate resilience, compact cities, enhancing urban quality of life are maybe delivered by, for example, promotion of active travel or public transport or reduction of mobility, all of which are key European objectives and also city objectives, can achieve the integrated policy co-benefits. And this is the totally critical part of the equation, if you like, so that we can improve air quality and at the same time reduce fossil fuel emissions, so we can achieve health benefits and also environmental benefits at the same time. And in a very similar way, but through a different mechanism, here the second example there is focused, for example, on nature-based solutions. So here we can look at the potential for nature-based solutions using green infrastructure, for example, to support active travel, walkability, bikeability. We can again achieve policy co-benefits through by addressing both the health dimension and also the environmental dimension simultaneously. Birgitte, if you could move to the second slide. Thank you. So the question is, how do we operationalize this in the urban planning process, and how does the Copernicus data come into play? I mean, I think the key thing is that we look to build our decision making clearly around evidence-based policy. We need to understand what's going on. We need the intelligence of the socioeconomic and environmental characteristics of the city. And we need to look at ways in which we can quantify these drivers of urban transition. And CURE comes in, and this is and Birgitte will expand on this in the rest of the presentation. CURE is responding to this by we're using the word underutilized Copernicus cross-disciplinary data. Essentially, we're looking to build on for example, land monitoring core service, the emergency core service, and use this data to work with in situ data and other data sources, socioeconomic data that we have, in order to support the decision-making process. So this is the way in which, and we look at those specifications of how Copernicus can be used in that way by engagement with our cities, of course, with cities are demonstrators of the CURE solutions. And so again, to finish on this, a couple of examples. So the data can help us in looking at the efficacy of policy actions, in the way in which we can implement the policy to seek these co-benefits. We can look at so-called what-if scenarios, looking at alternative ways, and this is very typical because we often have competing proposals for development in the city, and we need to see which is proving to be the most effective in terms of those key policy objectives like health and the environment in the city. And so I think also the second point here, the second example, is really looking at the way in which we can incorporate the co-benefit considerations into the decision-making process, and therefore we're looking to develop in CURE tools to quantify the estimated health benefits associated with active travel, for example. So I think this is the fundamental way in which urban planning, in a sense, operationalizes and moves us from innovation to operation in the way in which we were seeking in the discussion this afternoon. So I'll go back to you, Birgitte, if that's okay.
Okay, thank you. So for the rest here, we will then concentrate on some of the urban health issues, and I kind of like the figure here to the right, because it's kind of made, or it's made by an architect, an old guy called Arne Gehl, who has been studying cities for all his life, and for him, a city for people is a sustainable city, it's a lively city, it's a healthy city, it's an attractive city, and it's a safe city. And we have been trying to kind of describe this in a different way. So saying something about the physical qualities of a city that has to do with the traffic volumes, the building height, street width, number of people living there, commuting distance, green corridors, kilometers of cycle path per inhabitant, distance to green areas, things like that, which is kind of the physical qualities of a city. And then, of course, there are some climate qualities also. I mean, our climate is changing, and that's also something which we need to look forward to, or have to take into account when we do the city planning. So we're talking thermal comfort, the air quality, general comfort, wind, rain, so on. We know all about that here in Copenhagen. It's just a matter of dressing up, you know, people are saying, so that's what we do. It's sense of safety, and it's also, of course, aesthetic interest. I mean, it's nice to have a nice city to look at and move around in. All that is impacting the human behavior. I mean, if everything is very polluted, you don't really want to go outside. So, I mean, we want also to impact, how can we impact the human behavior, the life quality, to encourage outdoor physical activities, social activities, etc., etc. And the human behavior impacts the human health, and that we can measure in terms of frequency of doctor visits, number of sickness days, early retirement, premature death, for example. And that then we can translate into health costs in terms of mortality, morbidity, and again, we know the cost of hospital admissions, cost of medicine, sickness days, etc. So what we will try to do here in CURE is, this is actually the urban air quality, which is probably a little bit similar. Now, don't kill me if that is wrong, to the previous presentation, but this is made by Vito using satellite data. You know, where we had the regional background, air quality, we have the urban background, and then traffic peaks during the day, all impact the air quality. And the methodology that Vito are using are something here which I have absolutely no idea about, so I will not even try to explain that. But I mean, it comes up with the same indicators or measures for the PM10, PM2.5, etc. And here we see the EU reference values and also the WHO values and threshold values. I think the picture here is from Brussels, which makes sense since it's Vito who did this. So this will be developed in the CURE application 07, as you can see here, for Sofia. Then the idea is that we will take that results and we will put it into what is called the EVA model. And the EVA model, it's a short name for the economic valuation of air pollution. Unfortunately, it's not us who have developed that. We were going to develop something like that until we discovered that the University of Aarhus had already done it. So instead of reinventing the wheel, we are collaborating with the University of Aarhus to use this model and even improve it and so on, and to use that to answer questions like you see here. I mean, how is the air quality in my city? Well, we get that from the Vito application. And in particular, the question number 4, what are the health impacts and associated health costs of air pollution in Sofia? This is the methodology for the EVA model. So they start with emission sources, the air pollution concentration, the human exposure, where we get other data, of course, on demography and transport and age distribution and where people are living and stuff like that. The health effects, and that is mainly derived from in the Scandinavian countries. We have all these registers, health registers, which is quite unique. So we will always know whoever person, you know where they live, you know their socioeconomic background, and then you will be able to cross use these different registers in terms of what the health, why you go to the hospital, what kind of medicine you use, etc. So that is used for a lot of these health impact studies. The big medical companies are using as well, and that then we can translate into the socioeconomic cost, and this is what is done in the EVA model. So this has already been done for Copenhagen, and this is then to show you the kind of information which would be available for Sofia and hopefully also in the future then for other cities, because the idea, of course, is to develop this application so that it's easy to apply. Now again, we know that from Copenhagen there's probably much more information available than we will get from Sofia. So one of the tests here in this application is also to see how far can we get, how much results can we actually derive from what we can get from Sofia as such. So if we look at Copenhagen in 2017, when this study was done, there was 460 people dying prematurely, mainly from PM2.5. There was 440,000 sickness days. And the main sources, individual sources, is the road transport and wood stoves, in fact. And this about the wood stoves was very surprising, because a lot of people, it's quite fancy to have a wood stove in your apartment, in your house. And now actually they are kind of giving people money, to take them away again, because it has such a big impact. In terms of the total socio-economic cost of air pollution in Copenhagen, it amounts to 8.8 billion Danish kroner, which is 1.2 billion euros, which is quite a lot. And that also puts things into perspective, because you can do a lot of measures, to decrease the air pollution. So this is this has also led to decision to plant 100,000 trees in Copenhagen, again to absorb, to clean the air and try to mitigate from the air pollution. And then again in Copenhagen, I mean, it's not even that polluted. You can see here down here that I apologize that it's all in Danish, but yeah, it's a good way to learn a little bit of Danish. But the EU threshold values here, I mean, is not really exceeded in 2018. It is only the WHO are exceeded here. If you want to, I mean, again, I was really trying to find an English version, but here is, if you want to look at the total report, you can download it from here, and it looks like that. And with a little bit of Google translation, I think you can get quite a long way. I'm just showing this here really briefly, because this is then the actual air pollution for NO2, PM2.5 and PM10, and not surprisingly, or at least that was surprisingly for me, that you see the green stuff is all the regional background air pollution, and on the top here you have divided between person cars, trucks, small trucks, big trucks, buses, and so on. So that's the kind of details they are delivering in this report. Then all this, as I mentioned in the EVA model, is translated into health impacts. And again, this is all in Danish, and we are not going to go into details, but this is the number of incidents. So you have the mortality. So this is people dying prematurely from short-time exposure and long-term exposure, and also death between babies. And then we have morbidity. So here they distinguish between hospital admissions, episode with asthma attacks and bronchitis, and then days of lost work, sickness days, lung cancer. So all that translates into this kind of costs. Again, it's divided up on SO2, on O3, and NO2. So the biggest killer is the PM2.5. And this then is translated into socioeconomic numbers, and that's how we get to the 1.2 billion euros for 1 year, 2017, just in Copenhagen commune. So it's the 600,000 people living in the center of Copenhagen. So this is the kind of results we hope we will get also from Sofia. And then what we will also, of course, investigate is, so how far can we get with the data we have, and also the costs of doing it, and so that hopefully it's a kind of service that can be offered to whoever subscribe for it at a reasonable price. And some of the visions for the future, hopefully, as I said, in CURE we will do it for Sofia. And maybe also Berlin, I heard, but I don't know, I'm not quite sure. So again, what we will address in the CURE is the replicability potential. And also, in general, for a lot of these services, what is going to be interesting is how can we model it, how can we forecast related to the climate scenarios, how can we do simulations, that can better work for the decision makers at the cities, and also can be used to drive behavioral change. And also some of the, to a larger degree again, cross-thematic services developed, where we integrate the health aspect and the nature-based solution, so that you can have like cost benefit in terms of what it costs to invest in order to decrease the environmental impacts. Interactive services that cities to a larger degree can interact with some of these services instead of you have to have a really specialist to use the satellite data. And that comes also to some light versions. The city planners, need to have some tools they can work on a daily basis without having to pay for consultancies to do the work. And then, of course, there are the whole post-COVID transition. Is this something which we will have to live with in the future? And how is that going to impact healthy, sustainable cities? Yes, thank you very much. This is the last slide, actually.
Thank you so much. Thank you so much, Birgitte. Thank you, David. So the methodology is absolutely, it's absolutely interesting and fascinating. And I have no doubt, I think this is really the kind of data that cities need to take action to improve their urban environment. We don't have questions from the audience, and my only question for you at this stage is, do you think this service, if I understand correctly, this service will exist and will be proposed also after the end of SMURBS, right?
You mean the end of CURE?
The end of CURE, sorry.
Yes, hopefully. Again, it depends on how complicated it is to replicate it to other cities, but the University of Aarhus have already used it in other connection as well. So it seems to be a very interesting way of doing it, that you combine these different services. Why not use something which is already there if it works, and then really make sure that you develop in the right way so that it comes out there so people can use it instead of just sitting at a university. So that's the idea, really.
Even a good practice, and probably here a facilitator, is the proximity of the University of Aarhus with your own institutions. And obviously, there is replication out there sometimes also because we are not aware of everything that is going on out there. But I think that in this case, when you work with institutions that are within the city or nearby the city, it's much easier then to share the information and to capitalize instead of replicate on past experience.
Yeah, so it is. So you can say that the EVA model is already kind of operational. At least it has been used, in Denmark also to calculate the health cost for the entire country and also for specific cities. So yeah, it seems quite solid.
It's a really very impressive result. It's a virtuous case, and I hope that, we can only hope that this methodology is applied also in other cities. And it's curious that you made the example of the cities that already has a very good air quality compared to other European capitals. And there you see that why they have that good level of air quality, because they are interested and they take action, and they're interested in getting the data. So
maybe I could also add to that, briefly, if I may, that I think one of the strengths of the CURE project is that we're working what I call across the codes. So we have, I think, for a long time, Copernicus in one box, and then other initiatives for smart cities in other boxes, and they tend to work separately. And I think what we're doing in many respects by bringing Copernicus into the frame of integrating with other data and also building now on the experience of the other smart city governance projects, we begin, and including those outside the framework projects, the work of JPI Urban Europe, for example. There's a huge body of work there which we need to bring together, and that's one of the things we're trying to do in the CURE project to make that fusion of opportunity, if you like.
Yes, so thank you so much. We have to be conscious about time, so we'll run our last two polls and then we will proceed to the panel. Now, okay, so I couldn't visualize the polls myself. So do you think that the service presented is useful? That's for sure. Easy to use, reliable, cost efficient, and innovative. There are some reservations, of course, but obviously, everybody's interested in air quality and urban health. So let's go with the second poll and last poll of the workshop. So would you like your city to invest in this kind of solutions to improve urban health? Few seconds to reply. Okay, I guess we can close it. Okay, so they weren't super convincing for everyone, and that means that we need to find ways to better communicate about this kind of solutions. Thanks a lot, for your precious contributions. I hope that you're all bringing back some useful information and some inputs, and that you didn't get bored this afternoon. No. Bye, Jean-Jacques.
We were definitely not bored.
That's good.
No.
That's a very good thing.
I've been carefully listening to all what you said, and it's I would say a terrible privilege for me to try to wrap up all of this information that you so kindly shared with us. So definitely it's been a very busy and dense afternoon, and we have heard about the experience of many professionals working on innovative solutions to put satellite data to use in cities. So many topics have been put on the table, and I would like to really thank again all the speakers for having shared with us their thoughts, their hindsights regarding both the possibilities offered by the use of satellite data to make cities more sustainable and resilient to hazards, and the bottlenecks hindering their full exploitation, such as the lack of funds, of technical skills to produce the services, the difficulty to identify easy to use and reliable services that they can use throughout time. So we have seen that cities themselves, they are trying to overcome such bottlenecks by acquiring skills and techniques, often backed by academic and research institutes, and thanks to the funds made available by the European Commission in particular, or by the space community itself. What is clear to me is that a lot still to be done ahead of us to turn innovation into operation, but the will to do so seems quite present and obvious among all the stakeholders involved in this process. In the same way, cities are trying to involve citizens in co-decision processes. So the space community is making its attempts to work with cities to co-create the technological tools that will allow them to improve their management of the public space and to make cities more sustainable for their inhabitants and for environment. So all the stakeholders of the value-adding space chain, so from space agencies to the industry, service providers, European Commission, cities, administrations, and citizens, they have an interest in working together to build services that allow us to save resources and address concrete needs. And I would like to conclude this workshop by thanking again all the speakers, and in particular Linda van Devenbog and Julie Borsboom, who enthusiastically supported the organization of this event since its inception. I also thank the Smart Cities Marketplace for their support in communicating about this workshop, and invite all attendees to join our initiative on geospatial cities here. The whole workshop has been recorded and will be made available online, so together with the presentations. And we are looking forward to continue working on this issue of innovation in cities with all of you. So thank you very much. I guess it was a very fruitful workshop, and I look forward to the next steps that we have still ahead of us. Thanks a lot.
Thank you.
Thank you. Bye-bye.
Okay.
Thank
Well
you.
done, Grazia.
Thank you. It was a
Have a
pleasure.
good evening.